Good afternoon, everyone. It is now 12:01 p.m. I'd like to thank everyone that has tuned in today for, I believe, the sixth installment of our Best Chance Network and Wise Woman Rural Training Series. Today's focus will be on making the case for Wise Woman, why rural practices need to be providers. And really, at the end of the day, this is the reason why we are really going balls to the wall in terms of being, intentional about providing education and awareness about these very resource-rich programs for uninsured women. What we know and what we'll share today is the major disease burden that women in rural communities are experiencing. Wise Woman, as well as Best Chance Network, as well as the South Carolina Office of Rural Health have joined forces to be very intentional about, number one, increasing the number of rural providers offering these services. If women can get care where they live, work, play, and pray, they're more likely to catch disease early and survive. So that is the whole inspiration around this training series. Today, I have the pleasure of having the Wise Woman Program Manager herself, Linda Peccary, who will provide you with a more in-depth focus on what Wise Woman provides, giving you some statistics around eligible women in rural communities. And then myself, I am Tiffany Simpson-Crumpley, and I serve as the education and training consultant for this very wonderful and innovative project. And I'll wrap up today's presentation with just some lessons learned from existing Wise Woman programs. Again, today our hopes is by the time you leave this call, you will know all things about Wise Woman, the Wise Woman program, and the different services that are offered. We'll provide you with demographics and disease burden statistics impacting rural communities. And then we'll wrap up with the results of key informant interviews, which will be offered in the form of sage advice for those of you that are thinking about being a Wise Woman provider. So just a little bit about Miss Linda Peccary. She is the program manager for Wise Woman and has served in that capacity at DHEC since 2013. She is a native of Brooklyn, New York. She has 26 years of public health experience, and she is a graduate of the University of Minnesota with a BS in nutrition and dietetics and a master's in public health. Just a bit about me. I am a native of Oakland, California, raised in the San Francisco Bay Area. I was educated in California. I hold a bachelor's degree in health science as well as health services administration, and began my career on the front lines as a medical admitting clerk and a community health worker, often interacting with communities that are experiencing some of the similar struggles of the patients that you serve. I've been in the Southeast since 2006, and my specialty has always been collaboration and developing systems of care for uninsured and underinsured adults in North Carolina and South Carolina. Just a quick review. These are the previous webinars that have been covered to date. If any of you would like to listen to the replays, please feel free to shoot me an email. My contact information will be provided at the end of this presentation. So these are the 5 webinars that have been covered to date. The first one, the nuts and bolts of implementing an effective Best Chance Network program, was covered, because in order to be a Wise Woman provider, you must first be a Best Chance Network provider. So we talked about the rich services that are offered in that program and the critical components that providers need to be successful in running a great program and engaging patients not just once, but on an ongoing basis for breast and cervical cancer screenings. Second, we had got patient reminders. So then we dug a little deeper in terms of the type of knowledge that you have to have of your electronic health record system in terms of being proactive about looking at a population of patients that you serve that could be eligible for services and activating email campaigns as well as telephonic reminders to bring them into your office for services. Third, what everybody is worried about these days, how am I going to get paid for these services? So we had some wonderful billing experts from DHEC, Genevieve Gamble, as well as Latasha Chandler, who work behind the scenes, and they're the ones that process those billing forms. So giving you tips and strategies to avoid delays in being paid for services, and just really walking you through the steps that are needed to be successful in getting your claims paid by DHEC. The next one, the front desk, the gateway for effective patient engagement for Best Chance Network and Wise Woman programs, went back to just old school customer service 101, that you can have great clinicians in place. You can have a great patient engagement strategy or outreach strategy. You can even have a great biller or coding in your office, but guess what? If a patient is treated poorly, their lack of trust is going to pose a barrier to care and ultimately have them in a situation where by the time they are diagnosed with the chronic disease, it's often in its late stages, and they're more likely to pass away because they weren't able to access services effectively. They weren't respected when they came into the healthcare facility. So we talked about the basics of communication, but not just putting the onus on the front desk, but also creating a culture of engagement regardless of a patient's socioeconomic background, race or religious status, or class standing, and how important it is to provide a wonderful customer care experience to create that trust so that patient keeps coming back again and again to you for the best care possible. And then last week, we started introducing Wise Woman, which I consider the second component of the dynamic duo of comprehensive care for self-pay patients. And so really the idea of linkages between uncontrolled hypertension and obesity to the likelihood that a woman could develop cancer. So there are clinical linkages to that. So we want to always emphasize that BCN and Wise Woman come together as a package deal. So we started getting into the overview of Wise Woman last week, and now we're going to go a level deeper in terms of why it's important for rural providers in particular to provide services. I am now going to turn it over to Linda, and she will discuss Wise Woman with you.
All right, good afternoon, everybody. I'm really excited to be able to present some information to you this afternoon for a few minutes. And my goal is that by the end of this presentation, if you are not yet a Wise Woman provider, that you will be convinced that you need to do this program for your communities. So Wise Woman is an acronym. It stands for Well Integrated Screening and Evaluation for Women across the nation. That's Wise Woman. So the next slide, please.
Before Linda continues, if you have your phone open, please hit *6 to mute your phone. We are receiving feedback. Linda,
Okay.
Go ahead and proceed.
All right. So Wise Women is a national program. South Carolina is one of 21 states and territories to be funded. Since 1993, it was authorized by Congress. And what it does, it extends services to women who are enrolled in the National Breast and Cervical Cancer Early Detection Program, which here in South Carolina is called the Best Chance Network. So in addition to the Best Chance Network services, our women receive screenings for cardiovascular disease and diabetes. If they have a need for referral for a medical evaluation, that is provided. The neat thing, which I call kind of like the icing on the cake of Best Chance, is that the Wise Women participants can have opportunities to have health coaching and lifestyle programs. And right here in South Carolina, right now, we have the National Diabetes Prevention Program and Take Off Pounds Sensibly, in addition to health coaching. And then there's also referrals to community resources that would help these women get healthy with active lifestyles, maybe walking trails or Zumba classes or the YMCA, whatever's out in their local communities that would just reinforce the changes that they're wanting to make to get healthier. WISEWOMAN is funded by the Centers for Disease Control, and here in South Carolina, it is administered by South Carolina DHEC, which is the agency that I work for. We've had WISEWOMAN in our state since July of 2008, and we're funded every 4 or 5 years. So our first funding agreement was July of 2008 through June 30th of 2013. And I came on board as the program manager in November of 2013. So we're currently in year 4 of the 5-year cooperative agreement. So we'll be funded all the way through June 30th of 2018 and hopefully beyond. Next slide, please. So what is WISEWOMAN all about? The mission is that we want to provide low-income, on or underinsured women who are 40 to 64 years old with knowledge, skills, and opportunities to get healthier, to improve their diet, to become more physically active, and other healthy lifestyle habits to help them prevent, delay, or control heart disease, stroke, and other conditions such as diabetes. And the priority is risk reduction, and the focus is on blood pressure control. Now, I highlighted 40 to 64 because here in South Carolina, we also have Best Chance Network women who are younger than 40, but WISEWOMAN is only for the women 40 to 64. Next slide. So who are these South Carolina women? This slide shows that since July of 2013, when the program, this current 5-year cooperative agreement began in South Carolina, we have screened 4,776 women. And of those women, most are women 40 to 64 years of age, and most are the very poor. 71% of the women we have screened thus far have an income that is less than 100% of the federal poverty level. So these are older women, and these are very low income or zero income women thus far who have come through our program. Next slide. These two graphs show the race and the ethnicity. So again, of the women that we've screened so far since July of 2013, most are white women and most are non-Hispanic. Some people might think that WISEWOMAN is for like African-American women or very poor people, but we actually have a really good mix of incomes and race and ethnicity. Next slide, please. What I wanted to show you is the need for WISEWOMAN. In South Carolina, in this coming fiscal year, which will start July 1 of 2017, we are projecting a need of 65,229 women whose incomes are at or below 200% federal poverty level to be eligible, perhaps, for WISEWOMAN. So on the left-hand side of the chart, you'll see women whose income is at or less than 200% federal poverty level, 65,229 women. And what I've listed is the top 5 counties with the most women who would be or could be eligible for WISEWOMAN. So Greenville, Horry, Charleston, Spartanburg, Richland. So Greenville, more than 6,000 women. On the right-hand side of the chart, you see as we allow more women with a little bit more income, BCN and WISEWOMAN will be expanding our income guidelines up to 250% federal poverty level as of June 29th. Obviously, more women would fall in that category, and then more women perhaps would be eligible for WISEWOMAN. So these are staggering numbers, I think. To think that 65,000 to 75,000 women could potentially be eligible to receive services through the Best Chance Network WISEWOMAN program. And these are urban counties that are listed. So I will talk about some of the rural hotspots in just a few minutes. So next slide, please. Again, we're talking about why Wiseman. What is the need? I think we saw this map last week in the webinar, but here's a map of hypertension in South Carolina. This is a 3-year average prevalence between 2013 and 2015. And notice where the very dark green hot spots are on the map: Barnwell County, Lee County, Marlboro, Marion County, and then sort of the medium color green. So it looks like most of the hypertension is in the PD region, the eastern half of the state, and then some of the upstate. So the dark green is prevalence anywhere from about 44% to 49% of hypertension in adults 20 years and older. So next slide. So if we pair the hypertension hotspots with income of the women and the hotspot counties, this is what I put on the chart. So we have Marion County, Marlboro County, Barnwell County, and Lee County. These are the hotspots for a fairly high prevalence of hypertension. Women whose income would be up to 200% federal poverty level in these hotspot counties for hypertension, there's still a fair number of women who, again, would benefit from receiving Wiseman services. So anywhere from 271 women in Lee County up to 572 women in Marion County. With more liberal income guidelines coming up in the new fiscal year, women with incomes up to 250% federal poverty level, again, more women in these hypertension hotspot counties. So if you're a provider and you see your county listed and you see these numbers, are you reaching these women currently? If you're not a Wiseman provider, could you become a Wiseman provider and help to meet the need and help these women reduce their risk for hypertension, or if they already have hypertension, help them manage it well through the Wiseman program? Next slide, please. Let's look at diabetes. We know that diabetes is definitely a risk factor for heart disease, and we know that diabetes is on the rise all across the nation and also in South Carolina. So this is a map of average diabetes prevalence among adults 20 years and older between 2012 and 2014. So again, a 3-year average prevalence. And where are those hotspot counties? Again, the very dark green is mostly in the PD: Lee County, Dillon, Marion, Williamsburg, Clarendon, Calhoun, Bamberg, Allendale, Barnwell. In the Midlands, Fairfield County, and the upstate Abbeville. Prevalences of 14% to 17% diabetes in South Carolina. And I'd imagine these numbers are even higher since now we're in the year 2017. Next slide. Again, pairing the counties with the hotspots of diabetes with the income of these women, what I've done is listed the top, I think it's maybe 10 or 11 counties based on income. Look at those numbers again. Huge numbers of women who are potentially eligible, at risk for diabetes, or perhaps have diabetes in these particular counties, hotspot counties for diabetes. Are you currently reaching these women? Can you bring these women in your doors through the Best Chance Network and the Wiseman program? Can we bring these prevalence rates down over the years? It will take some time, but with the Wiseman program, we will provide resources for you to be able to do that. So again, take a look. Are you in one of these counties? Consider how you can reach these women by providing the Wiseman program. And these are more of your rural counties. All right, next slide, please. So let's transition a little bit and talk about what is it worth as a provider? What kind of income could you receive by offering the Wiseman program? So what I've laid out here is some sample scenarios of the income that could be generated per WISEWOMAN participant for the services provided. This is based on our current fee schedule, which is valid through June 29th this year. July or June 30th, BCN WISEWOMAN will be changing some of the fee schedule a little bit, but for now, we've got what we have here. So the dark blue across the top, the column headings are screenings. So in the screening exam, the woman will get a clinical exam. She'll be asked to complete a patient health history, and then there'll be some risk reduction counseling around the clinical findings and our health history. She may have an opportunity for a revisit for counseling of any abnormal screening values that are discovered at the WISEWOMAN screening visit. And then again, the neat thing about the WISEWOMAN program is the opportunity for health coaching, which is free to the woman, but as a provider, your health coach would be reimbursed fee for service. And then we have, what I've done is like added up the individual reimbursements and then factored it out over per woman or 100 women or 200 women. So scenario number one is a woman comes in, she has her WISEWOMAN screening exam, there's really nothing abnormal, but you still talk a little bit about her health history and a little bit of risk reduction counseling if needed. That's a $47 office visit. If you saw 100 women that year, $4,700. If you screened 200 women and there was really no risk factor per se, or they didn't want to do health coaching, $9,400. Where the money starts to add up is with health coaching and also with follow-ups of any abnormal screening values. So let's jump down to scenario number 3. We have a woman, she had her clinical exam. She didn't need to come back for an abnormal screening value, but she chose to do health coaching. She wanted to learn more about how to be physically active, or how can she modify her diet to reduce her cholesterol level or something. She wanted health coaching. So at the provider level, you have a health coach or more than one health coach. They meet with the women and we reimburse fee for service. So let's say a patient had one individual 30-minute health coaching session. We will pay you $45, and then the coach followed up with her twice by phone for about 15 minutes, and we reimburse each of those phone calls for $20 a piece. And then we ask you, we being DHEC, we ask the health coach to submit her health coaching data online through our Medit system, and we give her a little bit of incentive to do that, $5 per online data submission. So for that one individual who had her screening exam and then she had the 3 health coaching sessions with the health coach, we have now reimbursed you $147. Let's say 100 women had the screening visit and 100 women participated in 3 health coaching sessions. You are now reimbursed $14,700. And in an ideal world, you saw 200 WISEWOMAN participants and they all completed health coaching. You are then reimbursed $29,400. So it's really a very profitable program for providers to provide profitable to you income. Profitable is a way to bring more women through the doors and serve your community. Profitable for the WISEWOMAN patient herself because she's getting valuable services, she's getting that individualized health coaching, that one-on-one time, or she may be in a group health coaching class and she's getting the peer support. So again, I think everybody wins with WISEWOMAN. Next slide, please. So what does it take? If you are brand new to WISEWOMAN, I'm sure you probably have these things in place already, but if you're thinking about becoming a WISEWOMAN provider, there are certain musts in order to be a WISEWOMAN provider. So number one, you must already be a current Best Chance Network provider. You cannot do WISEWOMAN without Best Chance Network. And again, WISEWOMAN participants who are ages 40 to 64 must also be BCN patients 40 to 64 years old. In order to do WISEWOMAN, you have to have staff to provide screening services. And likely these will be the same clinicians who perform the BCM screenings. Oops, go back to the slide.
Hold on just a minute. Let's see.
Can you go back to the previous one?
This one? Or the second provider must?
Oh, no, the one next. There we go. With WISEWOMAN, you also should have staff that are skilled in providing risk reduction counseling that's patient-centered, people who are really motivating to these women, who can really coach them through lifestyle changes and motivate them to participate in health coaching or to participate in national DPP or TOP. So, and again, these could be staff such as nurses, health educators, dietitians, social worker, a behavioral health counselor, a pharmacist, a physician assistant, pretty much anybody with kind of a clinical sort of background would serve well as a health coach. To do WISEWOMAN, you also must be able to demonstrate that you have success in helping patients manage their blood pressure. And if you need help with setting up or identifying any of these factors within your clinics, I know that the Office of Rural Health and our DHEC WISEWOMAN team would be happy to assist you in developing those systems of care. Okay, let's go to the next slide. So the previous one was about the must. You have to have those things in place in order to do WISEWOMAN. This slide shows things that are kind of the extras or the nice to have, the ideal to have, but not necessary. In-house case management for hypertension. Now, we do expect you to address hypertension with the WISEWOMAN participants as applicable. And it would be great if you have some sort of way to kind of manage that patient in-house. It would be ideal if you help your patients reduce barriers to understanding treatment regimens or to accessing and receiving medications for free or for very low cost, particularly for hypertension. Because again, WISEWOMAN is mostly about managing blood pressure. It's also great if you also have chronic disease management programs that you're already doing, for instance, diabetes self-management or better choices for health. These we can help work in as a lifestyle program for WISEWOMAN participants. And if your clinics are located in communities that have free or low-cost healthy lifestyle resources, that's always a plus, because in addition to what the WISEWOMAN patient can get through your individual clinics, when she goes home at the end of the day, if she lives in a community where it's easier to be active or there's resources that will help her to become active, that's ideal. Now, I understand that, South Carolina is very rural. Not everybody's going to have a YMCA or a walking trail, but as much as possible, where those things are available, we want to be able to link these women to those resources as well. Okay, and I've got one more slide. And this is sort of just a teaser to whet your appetite for next week. But what I put here on the slide was some testimonies from health coaching participants that we have received over the last couple of years. Just again to show you that it really makes a difference in women's lives. Something as simple as a woman decreasing soda consumption from 2 liters daily to weekly. Some women have been very successful with losing weight through diet and exercise. I like the taking off of her blood pressure medicine. That's really, really cool because, again, WISEWOMAN is mostly focusing on blood pressure management. And if we can take a woman off of one of her blood pressure medicines and have her manage through healthy lifestyle, that is awesome. Women have achieved drops in their hemoglobin A1C levels. They have quit smoking. Again, a really wonderful program to bring to your communities, to bring to your patients. So reach in, look at your patient population, who is eligible among the current patients that you serve, bring them into Best Chance Network and WISEWOMAN. Encourage them to get into health coaching, or if they're pre-diabetic, where the diabetes prevention programs are available in your community, WISEWOMAN will support her way through that. If she wants to lose weight and there's a TOPS chapter in her community, again, WISEWOMAN will support her participation in that. So I really believe it's a win-win all around. If you're already providing WISEWOMAN, great, thank you. Improve, see more women, bring them back in for screening. Again, if you're new and you want to do WISEWOMAN, be sure you're already a Best Chance Network provider. Talk to me. We'll get you started with adding WISEWOMAN. So I appreciate the time. Thank you, Tiffany, for allowing me to speak for a few minutes.
And Linda will be available for Q&A. So please, any questions that you have the choice of I can unmute you and you can ask your question live, or you can submit them in the chat box. And so when we come to the Q&A session, I will be going through in the order that questions were received, and Linda will be available to answer any questions that you may have. So I am going to take the baton, and here's Linda's information. It's also provided again at the end of this presentation. So please, if you are thinking about providing these services in your facility, Linda is your first line of fire in terms of what that process looks like. So there's her contact information there, and we'll go ahead and proceed through our presentation today. So as a part of the partnership with DHEC's WISEWOMAN program, as well as the BCN programs, we wanted to learn from folks that are doing this work all day, every day, in terms of what works, what doesn't. So I had the opportunity to interview two programs that are offering WISEWOMAN services in rural communities. And the interesting thing is that the core building blocks for a great BCN program or a Best Chance Network program are also the same building blocks that are necessary for a WISEWOMAN program to be successful, particularly in a rural community. So to depict it visually, and this continues to build on Linda's provider must-haves, these are the common threads that I saw across BCN and WISEWOMAN programs that were successful. Most have a designated staff person who is the practice champion, or in this case, a health coach for WISEWOMAN, and often those responsibilities reside in that one position. Now, it's not just their sole responsibility, because we realize to serve a patient effectively, it is a team approach. So the physician or the nurse practitioner knows her role. The medical assistant has her role in the process. The front desk has their role. The biller has their role. So everybody is really clear about what is expected in terms of activating the program deliverables. And so, again, I talked about defined team roles and responsibilities. At the center of all of this is the patient. In previous webinars, we've talked about the importance of staff being very comfortable with being able to go into their EHR system and pull reports of women who may be eligible for services, and activating telephonic reminders through your EHR system, or investing in a phone reminder system separately. Though that is critically important, particularly for underinsured or uninsured populations, women who are transient. Everybody has a cell phone at the end of the day. So really just going down to the nitty-gritty of what it takes to engage a patient at your practice or your clinic. Finally, having a good billing and coding strategy to make sure you capture the necessary information that is needed to be paid by BCN and WISEWOMAN. So these are the core building blocks that I have found personally by interviewing existing programs. And so I interviewed Federal Healthcare Network. They are based out of Charleston, but many of their sites are in rural isolated communities. So one of the things that the staff, and I'd like to personally thank Ellen Wilson, who was responsible for Best Chance Network and Wise Woman activation within that system, for offering her time to share with me these tips for success. So one of the things that she said definitely is that you must have dedicated staff to act as a health coach and navigate women through the different aspects of the Wise Woman program. And for those of you thinking about becoming providers, do you have adequate staffing levels? Thinking about that before you even enter into a contractual arrangement as a Wise Woman provider. One key thing that she noted is that if any of her sites did not have a designated staff person, it made it very difficult to implement the program. So you may be a part of a system that has multi-sites. So you may have an administrative head, but at each one of those sites, there needs to be a staff person that someone can pick up the phone as the BCN or Wise Woman point of contact. So that she noted that as being critically important. Also, she discussed considering partnering with community organizations to provide physical activity opportunities. As we all know, in rural communities, transportation is an issue, and really there are not a lot of goals, gyms, and 24-hour fitnesses in rural communities. So really thinking about being creative. I am aware that the YMCA has a pre-diabetic prevention campaign going on across the state, and they are looking to partner with rural providers to provide services to women and possibly deploy staff to provide physical activity opportunities. So, and then finally, billing know-how is important, and you can go through a training one time, but also Ellen noted that it's important to kind of have refreshers as you're going through the implementation of your Wise Woman program process to make sure you're doing things correctly, and again, filling out forms to make sure you are paid in a timely fashion. I also had the pleasure and privilege of interviewing Paula Watt, who is pictured in the orange shirt on the right-hand side of this picture in front of the mobile unit that Clemson's free clinic provides Wise Woman services on. And so Paula offered tips for success as well. I also interviewed Caitlin, who works very closely with her in terms of program implementation responsibilities. Their tips for success included the following: pre-qualify patients via phone call prior to mobile screening events and initial appointments. One of the things that they emphasize with women in rural communities, so while they are based in the Clemson area, they provide services, mobile screenings across the state. And one key thing that they drove home is to be able to do as much as you can for a woman while she is in your presence. So their appointment slots are 2 to 3 hours long, and they go from start to finish. So they'll pre-qualify folks over the phone, but then that woman comes there and she goes through stations of care. So she receives Wise Woman and BCN services in the same day. Now, those of us that are privately insured know that we would have to probably schedule 2 or 3 appointments to accomplish what they can do in a 2 or 3 hour time slot. They prep women, they let them know what they need in terms of qualifying information, but also preparing that woman so that she's ready to be there for upwards of a half a day, but all of her services are met in that day. They also emphasize the importance of making sure that you have your EHR, that your electronic health records system, reflect Wise Woman forms. So they particularly use OWL scripts, and they have managed to figure out a way to integrate Wise Woman form information into their EHR so it's captured, and it makes it easier to fill out forms. So they also, in order to accomplish that objective, they use nursing and allied health center students to support their activities in the community. So they're literally taking students out on the mobile unit to help them navigate the women through the stations of care system that they have set up. So these are just things for you to think about. particularly around using health students. Just about every rural community is served by a technical college system. Guess what? They have CNA programs. They have certified medical assistant programs. And as Linda said, even any type of clinical background would be helpful in, having an extra person to help you act as a health coach or to work with women in your program. Plus, it provides a rich learning experience for students really needing a rich externship opportunity. So these are just some things to think about as you're thinking about, hey, is this a good fit for my practice? Is this a good fit for my center? Again, building on Linda's points, she really made the financial case for becoming a rural provider, but based on the figures that were presented to you, it's an opportunity to increase revenue for your practice through initial screening and follow-up appointments for both programs. So we saw figures, if you saw upwards of 100 women a year, that you could earn, anywhere between $20,000 and $40,000. That could translate into a position, an extra person to serve women through your practice. So really be thinking about the long-term benefits of becoming a provider. Again, being able to receive free diabetes prevention education services, the coaching component of WISEWOMAN, is invaluable in terms of, and one thing I learned new today, and Linda, correct me if I'm wrong, so if a woman is served by WISEWOMAN and she doesn't have high blood pressure or diabetes, but still wants health coaching, can she still receive that service?
Absolutely, yeah. She doesn't have to have a disease condition or a diagnosis. She can just do it because she wants to learn more. We can always learn something new. So, yeah, it's absolutely free. We will pay for up to 6 health coaching encounters.
And thanks so much. So that was one thing I learned new today, and I want to impart that to you because think about those of us that are privately insured. We'd have to pay that famous program upwards of $10 a week to weigh in and receive coaching. So think about how rich of a resource that is for a woman who is working, doesn't have health insurance, but doesn't really have enough to secure health coverage, but she can still receive these rich coaching services. So that's just something to think about as well. One key point that I'd like to drive home about becoming a WISEWOMAN provider is the idea that the services from screening to intervention and health coaching nicely aligns with practice improvement measures that are going to need to be met for patient-centered medical home accreditation. If you're looking to improve on your HEDIS scores or your PQRS scores, these vehicles allow you to negotiate for higher payment with the different payers for Medicaid and Medicare. And speaking of that, health coaching in particular is one of many practice improvement activities that you would receive credit for under the Medicare merit-based incentive program. So again, if you lay the foundation with BCN and WISEWOMAN, you're already setting yourself up to be competitive and be able to negotiate for higher rates of pay for the services that really you're providing already. I always include these slides on every presentation because I want you to realize that if you build the foundation for your medical home, it's going to continue to translate to better payment opportunities. So for the PCMH program, Medicaid is increasing reimbursement by 50 cents to $2 per member per month for being a PCMH accredited site for meaningful use. If you're able to demonstrate these quality measures and improvement in these areas, you can also qualify for incentive payments as well. Again, driving home the HEDIS and the macro benefits that are directly aligned with offering these services. So we've shared a great deal of information to you, but really at the end of the day, what do we want you to do? The call to action is to become a WISEWOMAN provider. If you are on the phone and you're thinking about Wise Woman and you're offering Best Chance Network, you have the opportunity to add on Wise Woman as the second component of that dynamic duo that I always speak about, and just add it as an addendum to your existing new 5-year contract that is coming up soon. Not a BCN provider. I'll be providing Dr. Trinessa Jones information. She will be your point of contact to sign up for BCN, and you can sign up for Wise Woman at the same time. For either program, think about who is a key member of your staff that could be an ideal practice champion or a health coach, because that's critically important. And then you do that and send them to the health coaching boot camp that the Office of Rural Health is sponsoring with the gracious support of Best Chance Network and Wise Woman. That will occur on Monday, June 26th from 9 a.m. to 3 p.m. And the first half of the morning will be facilitated by Dr. Cheryl Dye. She is the state's leading expert around peer health coaching for hypertension, and has a great track record for training lay people from the community to be health coaches and empowering them with the right information to bring down rates of hypertension in their community. So the first part of the morning is going to really be fun and engaging activities, role plays, clinic scenarios where you can really learn about health coaching. But guess what? You're probably already doing health coaching and just not calling it that. So that's coming up at Monday, June 26th. In fact, if you look in your chat box, at 11:50 I posted the registration link. The event is now live on Eventbrite. So if you simply click that link, it'll take you to a registration page and give you all the information that you need to know. We are now at our question and answer session. So please feel free to type your questions in the chat box. And if you have any questions and you would like to talk live, please raise your hand. So let's go to the chat box. Okay, so first question is from Lisa Melendez. Thanks, Lisa, for posting this question. I know you've mentioned this before, but can you please tell me how I can get copies of your PowerPoints? I will be more than happy to share those slides with you. Within 24 hours of this presentation, the actual recording will be available. So if you're interested in slides and the recording, I'll make sure those get out to you. And I believe as soon as the recording is ready, all of you will receive an email notification that will let you know that the recording is ready. And you can share that with anybody that would benefit. Perhaps you're a part of a system of clinics and you may be a site and then your sister site is not implementing BCN or Wise Woman. I'm really big on rip off and duplicate, Lisa. So you are more than welcome to have these materials. Second question, again from Miss Lisa. In the new fiscal year, will the maximum amount of sessions we can see still be 6? Will still be 6 within 6 months? So that is a Linda question.
Yeah, health coaching completion is actually 3 sessions within the first 6 months, and then she can have an additional 3 within her year screening cycle.
Okay.
So completion is considered.
You said completion is considered 3, Linda?
3, yes, but we will pay for up to 6.
Okay, and those 3 sessions have to be completed within?
Ideally within the first 6 months of when she starts health coaching.
Okay. And I think that's all I see. I'm going to run through the attendees to see if any hands are flashing or hands are up. They are not. So again, this will not be your first or last opportunity to pose questions to Linda, and I'll be bringing her back next week. I haven't formally asked her to, but she'll be coming back next week to discuss with you the TOPS and the diabetes prevention portions of these programs. So we started touching on health coaching today. She's going to go more in depth about what health coaching looks like. And I really would love for you all to have the benefit of hearing from a Wise Woman program provider. So if you know of Wise Women programs or you are implementing a Wise Woman program, I would love to have you as a guest presenter because I truly believe that peers learn best from one another. So if you are interested in being a guest presenter along with Linda for the next week's webinar, please let me know. Next week's webinar is June 1st, and we'll really go into depth about the diabetes prevention program and taking off pounds sensibly, education opportunities, and really discussing what that looks like on a day-to-day basis in a Wise Woman program. On 6/8, we're going to bring back Ms. Genevieve and some other members of the team over there at DHEC to talk about billing for success. So because Wise Woman has some other moving pieces and forms that are required, we want to definitely engage the folks that process those forms all day, every day, and give you the tips to keep you from making mistakes when you submit your forms. Then again on 6/15, we also want to talk about screening events because that is an ideal opportunity to increase your visibility as a primary care provider, but also really in a very focused way bring women in for BCN and Wise Woman screening services. So we'll bring back some of our folks from the field that have done these screening events before and have been successful in doing so and giving you the tips so you can possibly think about doing your own. And then last but certainly not least, we have the Health Coaching Boot Camp coming up. We have, since the last week's presentation, we have identified a location. That will be at the Wingate by Wyndham Hotel in Lexington, South Carolina. That's right off of Interstate 20. And we are looking for existing Wise Woman health coaches who would just like a refresher opportunity, but we're also looking for the newbies, folks that are saying, hey, I want to be a Wise Woman provider, and this will be a rich and rare opportunity to engage in live training. Linda is only one person, and so there's a whole state to serve, so this is an opportunity to engage in a day-long training with folks who are already health coaches and engage in some really rich activities so you are ready to go when you go back home and you're ready to start offering these services to the women that need them the most. So again, in your chat box, there is a hyperlink where you can click on it and go right to Eventbrite to register for the boot camp. The ideal audience for the boot camp, again, is anybody that is interested in offering BCN or Wise Woman services, medical assistants, CNAs, community health workers that may be connected to a primary care settings. Please send your folks to this training. And again, that's on Monday, June 26th. And in addition to offering technical assistance, we do have staff that can be deployed to your site and provide focused observation in terms of helping you with workflow. If you're struggling with your electronic health record system and how to pull reports or activate a reminder campaign, we have a wonderful expert, my partner in this endeavor, LaShonda Petaway Brown, who is gifted in that regard. So she can also provide technical assistance with patient-centered medical home accreditation, preparing you for MACRA, which is the merit-based incentive program, setting you up to be successful in that, and rural health clinics. That is a designation that provides you with increased reimbursement for services. We have a staff person that is skilled in regulatory compliance and can give you billing and coding advice. So these are all services that are available out of our office. And these are your points of contact. Dr. Trinessa Jones is ready and available if you're thinking about providing Best Chance Network services as the first step in this journey. That's her contact information. Linda, thank you so much for your presentation today, and that is her contact information. And then I have mine. My name is Tiffany. If those of you are interested in previous recordings of past webinars, if you want to be a guest presenter, if you want PowerPoint slides, that's my information, my email address, and I will respond to you as soon as you send me a message. And LaShonda Pettaway Brown, that is my boots on the ground partner in providing that on-site technical assistance. So feel free to reach out to her and let her know that you participated on this webinar and that you may need help. So I will bring this presentation to a close. Please join us next time. We're going to take a break for the Memorial Day weekend, and we will join you on the 1st for more of Wise Woman. Thank you so much for tuning in, and I look forward to seeing you on future webinars. Take care and have a great day.